Hi guys, I'm Kashvi and today we're going to be talking about basic first aid. Broadly speaking, there are three main aims when it comes to giving first aid, and these are known as the 3 Ps. Preserving life, preventing worsening, and promoting recovery. This brings me on to calling for help. On the screen are listed some numbers we should all be familiar with, but I think it's important to note that in a non-emergency situation that requires fast medical help, 111 should be dialed instead of 999. If you find yourself somewhere in a remote area, even if your phone doesn't have network itself, it will connect to another nearby network. So although your phone might not have service, your emergency call may still go through. If you find yourself in a situation where someone is collapsed, you can use the Dr. ABC method to help you remember which actions to take. The first one of those is danger. So the first thing you must do is ask yourself if there's any risk. These include vehicles, electricity, water, other people, smoke and fire. And if you can, and if it's possible, try to remove that danger. But you should always remember that you should only enter a situation if it's safe to do so, and you're the most important person in that situation. Moving on to R of our Dr. ABC. R is response. So the first thing to do is try and wake the victim up. Are they responding to you? You can do this by kneeling by their head, shouting in their ears, although I don't personally like that one. You can always tap them on the shoulders, flick them on the back of the ear, anything to just get their attention. And if you don't receive a response, they are unconscious and this is an emergency. So you mustn't leave the patient and try and shout for help if you can. A stands for airways. So when a patient is unconscious, their tongue can fall backwards and block their airway, causing an obstruction and suffocation. Similarly, they may vomit, which can also block their airways. But it's important that you don't put your fingers down into their throat to remove any obstruction, because you never know, they could wake up, they could bite you. It's not safe to do so. So this is where you have to perform the head tilt, chin lift manoeuvre, which involves placing one hand on their forehead and tilting their head backwards, then placing 2 fingers on the bony part of their chin and lifting it up. You can see this on the diagram on the slide. Now the next step is checking for breathing, which involves looking, listening and feeling for normal, regular breathing for up to 10 seconds. It's important to note that irregular, shallow gasps aren't normal breathing, and that should be ignored as a sign for breathing. If the patient is not breathing normally, immediately call for emergency help if this has not already been done, and if they are breathing, place them in the recovery position. A defibrillator is an electrical device which can be used to help restart someone's heart. CPR on its own is unlikely to restart someone's heart. However, it will increase the chance of a defibrillator being successful, so it's definitely worth doing. Next, the process of CPR involves 30 chest compressions followed by 2 rescue breaths if you are trained to do so. But when I looked into it, when I was doing my first aid training, the evidence actually suggests that rescue breaths don't actually do much to help a person or increase their chances, so it's perfectly fine not to. As shown on the diagram, you should interlock your fingers and push down 30 times at the rate of 100 to 120 compressions a minute. This, as well as marching, is often compared to the song Staying Alive, which is quite fast and can be quite tiring. So if there is somebody around you, somebody with you, try and swap every 2 minutes just to stop yourself from getting too tired out and to make sure that you do it properly. Next is some more info about rescue breaths, but of course if you aren't trained, they recommend you don't do them. It's quite common knowledge that during CPR, ribs will be broken, and that shouldn't put you off doing CPR because because the benefit outweighs the negative, I suppose. On the last slide, there's a link to the St John's website for more info about first aid and online courses that you guys can be doing. Thanks for listening, guys.